What's this? It's a drain. So a lot of my patients wonder, why do I use drains? Well, drains are very important in surgeries because they help us get rid of fluid in places where we don't want fluid. The body tends to fill empty spaces with fluid. And in liposuction, for example, there's a big empty space where we're taking out the fat between your skin and your body. All of that fat is gone, and the body wants to fill that space with fluid. Now, a lot of that fluid that's in that space is going to come out the first day and the first night. But there's more fluid that builds up through the healing process. And even though we use garments to help compress that empty space and help that skin stick down to the deeper tissues, fluid can still build up. Without a drain, 35% of patients can get a fluid collection. That's a lot of patients. The advantage of the drain is the drain gives a place for that fluid to go after the incisions have closed, because the incisions close after 2 to 3 days and the fluid can be trapped. So with massage, we're able to move that fluid out of the body into the drain. This is the outside part of the drain. Normally there's a tube that's attached and there's a part of the drain that's in between the skin and the deeper tissues. This bulb fills up with fluid, sometimes quickly, but usually relatively slowly. When it gets full, you will need to empty the drain, and that's actually a very simple thing to do. So you'll undo this plug. This part is attached to the drain tube, and you'll simply, over a trash can, squeeze the bulb until all of the fluid is gone. Now, while you're squeezing on that drain, you're going to take that plug and put it back into the hole where the fluid just came out. And the drain should hold suction. Now, it's important for that drain to hold suction because that helps create a vacuum, which helps get rid of that fluid. If your drain does not hold suction for the first couple days, don't worry. That's normal because the other incisions need to close completely. Another reason that patients are concerned with their drain is sometimes they'll have fluid that drains around the drain tube itself. Don't worry about that. That is a very common thing. Most patients will have fluid that drains around the drain for 2 or 3 or 4 days until that incision heals around the drain and seals. So patients a lot of times will ask, how long do I need to keep my drain? Well, that really just depends on the type of surgery that you're having. Most abdominoplasty patients will keep their drain between 7 to 10 days after surgery. With those patients, the timing of when we need to take out the drain depends on how much fluid is in the bulb. We want to see less than 25 cc's of drainage, that's the bottom line here, with the drain open per day. And we'll go over that with you after surgery so that we've answered all your questions. With liposuction patients, the timing of the drain really depends on the timing of the patient's massages. We want to leave the drain in as long as we can while the patient is here until after they've had their last massage. Because if we take out the drain and then the patient has massages, there's a very good chance that that patient will build up a fluid collection and we won't have a drain. So we want to leave the drain in as long as we can until after the patients have finished their massage.